We begin this morning in Afghanistan, where the U.S. and other countries are now warning people to stay away from Kabul airport amid growing fears of a possible terror attack there.
The threat comes as thousands of Afghans gather at the airport, vying for a seat on an evacuation flight before next Tuesday's deadline. But in an exclusive interview with our Richard Engel, a Taliban spokesman said he hopes those Afghans will stay when asked if the Taliban would let them leave in the future.
We don't want our countrymen to go to America. Whatever they have done in the past, we have given them amnesty. We need young, educated professionals for our nation. But if they want to leave, it's their choice.
What would you say to women, Afghan women, who are terrified?
They are our sisters. We must show them respect. They should not be frightened. The Taliban are humans and from this country. They have fought for their country. Women should be proud of us, not scared.
We have a team following the latest developments this morning. NBC News White House correspondent Jeff Bennett and global correspondent Raf Sanchez is in London. Jeff, let's start with you. So what are U.S. officials saying about this terror threat at Kabul airport? How serious is it?
Well, in an alarming sign of the deteriorating security situation around the airport yesterday, the State Department warned Americans who might have been gathering outside to evacuate 3 gates leading into the airport. Of course, the Kabul airport is the only way for Americans right now to find their way out of the country. And so the window for evacuations is closing quickly. 5 days remain until we arrive at President Biden's self-imposed deadline there for the full withdrawal of U.S. troops. But there are questions about when exactly the Pentagon will switch from ceasing the evacuation of civilians to withdrawing U.S. troops, withdrawing and destroying equipment there at the airport.
And now, Raf, it's actually not just the U.S. that's issuing this terror warning. What are British officials also saying about this?
Savannah, that's right. The UK has around 1,000 troops in Afghanistan right now, serving alongside American forces at Kabul airport. And the British government is echoing that warning from the United States, saying to its citizens, do not go to the airport. And if you're already there, get away, get to a safe place. A UK defense minister said today there is an imminent threat of a, quote, highly lethal terror attack in Kabul, potentially within hours. Take a listen to what he had to say.
I can't share with you the exact detail of what the threat is, but I can say that over the course of the week, the credibility of the reporting has reached the stage where we believe that there is a very imminent, highly lethal attack possible within Kabul.
Now, the UK and other allies tried to convince President Biden to extend his August 31 deadline for keeping U.S. troops in the country. They weren't able to change his mind. And so the British are also getting ready to pull their troops out over the next couple of days. Savannah?
So, Jeff, Secretary of State Antony Blinken said yesterday about 1,500 Americans are still in Afghanistan. So where does the evacuation effort stand, and how could this terror threat around the airport impact that?
Right, and the secretary said of that number, the U.S. is in constant contact with about 500 Americans, and the other 1,000 they are frantically trying to reach. But we also heard from Secretary Blinken that if there are Americans or Afghans who remain in country beyond August 31st, and there likely will be, he said that the U.S. will spare no resource, diplomatic, economic, to help those folks find their way out. Here's a bit more of what he had to say yesterday.
But let me be crystal clear about this. There is no deadline on our work to help any remaining American citizens who decide they want to leave to do so, along with the many Afghans who have stood by us over these many years and want to leave and have been unable to do so. That effort will continue every day past August 31st.
But as you can imagine, there are more questions than answers right now about how that process would work. What potential third-party country would remain there working with the Taliban to keep that airport open and functional, Joe?
Yeah, absolutely. And Raf, we just heard from the Taliban spokesman there in this interview with Richard Engel saying he wants Afghans to stay in the country and that the group respects women, that they're their sisters. Do people believe that message at all, or are they still focused on getting out of the country?
Yeah, every indication we have right now is people who were planning to leave the country are still planning to leave the country. We are not hearing from folks who are suddenly reassured by what the Taliban are saying and are deciding to stay. People remember very clearly the brutality of the Taliban regime that fell 20 years ago. They remember women forced to wear burqas. They remember women being stoned to death after being accused of adultery. We should say we are less than 2 weeks into this new Taliban regime. We don't yet have a sense of what their social policy is going to be. They are very focused right now on the basics of government, security in the cities, collecting the trash, getting the traffic moving, manning the border posts, things like that. But the real fear for people in Afghanistan, and especially for women, is that once this new Taliban government settles in, consolidates power, they're going to go back to that very harsh system that they had in place 20 years ago. Guys.
All right, Raph and Jeff, thanks so much for kicking us off. Appreciate it.
Hospitals around the U.S. are once again at max capacity as they deal with a surge in COVID patients. In Mississippi, the state is working with FEMA to deploy additional healthcare workers to some overwhelmed hospitals. NBC News correspondent Ellison Barber joins us now from one of those hospitals awaiting help, the King's Daughters Medical Center in Brookhaven, Mississippi. Ellison, good morning. Thank you for being here with us early. So what's the state seeing now in terms of COVID cases there where you are in Mississippi, and how will this emergency deployment of staff there to that hospital work?
Well, so in terms of the vaccination rate in this state, there's a little bit of good news on that front. Vaccination rate, it rose again last week. It's risen by more than 125% in the last month. But in terms of the infection rate, the hospitalization, the death toll, those numbers are still not at all where the state would like them to be. Just look at some of these numbers with me. This state has one of the highest infection rates per capita in the entire world. 98% of those new cases are among the unvaccinated. That's according to the state's health department. 1,655 infected patients, 484 patients in the ICU right now, with 336 on ventilators. At this hospital where we are, they are up at a capacity level of 185%. Last week, they say they were having conversations about which patients they would need to take off of ventilators if they were to run out. And they say they were very close to having to make that call to actually ration care. In terms of the additional staff, Governor Tate Reeves announced on Tuesday that he, along with Mississippi's Emergency Management Agency, they were working with FEMA, and they're going to deploy over 1,000 additional healthcare workers from contractors, outside companies, to come and help at hospitals that need it. There are 61 hospitals in this state who have requested some sort of staffing assistance. This hospital is number 17 on that list. They have already started deploying nurses, respiratory therapists, and Savannah, they say that they will have help out at least 1,000 within about 9 business days from that initial announcement. Savannah.
Ellison, you just mentioned some of those things that I think we were all hoping we'd never have to hear about again, making those different types of decisions, difficult decisions about how to care for patients, what type of opportunities patients are going to have to get the care that they need. And with a hospital like that working at double capacity, tell us more about what types of decisions they're having to make in terms of care for patients.
Yeah, I mean, this is a small hospital, a small rural hospital. We're about an hour outside of Jackson, Mississippi. We went inside yesterday to both the COVID ICU here and also the emergency room. Part of why we went into the emergency room is because they actually have patients there who need ICU beds, but they have nowhere to put them. We saw 2 different rooms where they had 2 COVID ICU patients in each room, all 4 of them on ventilators. They should be upstairs in the ICU, but they are way past their normal capacity level up there, and they literally have no space. They have 3 ER nurses working to take care of the ICU patients in the emergency room, while the ICU nurses continue to treat and take care of the dozens of patients they have upstairs. Listen to what one emergency room nurse told us.
Heart attacks, strokes, with nowhere to put them, no nurse to take care of them. We had patients in the waiting room that needed to come back so bad, and we couldn't bring them back. We had family members getting upset with us, but we had no choice. We were maxed out. We used the wall as a room. Every inch corner of the wall. It was a nightmare. There was people everywhere.
Savannah, we hear so many times and we talk so often about how when we're discussing capacity, it is not just beds, it's not square footage, it is nurses, respiratory therapists, doctors who can give the level of care necessary. And obviously, just listening to what they're going through here, you cannot forget that other health issues, other emergencies did not stop because of COVID-19. And this hospital, they're seeing all of it. And they serve 5 different counties around them, and they really do not have the capacity, the means to keep doing this. Savannah.
Absolutely. And you think about those family members who are just waiting for help. And then, of course, the nurses. I know they told you that they are so tired. Ellison, really incredible reporting. Thank you so much.
South Dakota is now seeing a massive surge in COVID-19 cases 2 weeks after the Sturgis Motorcycle Rally. More than 500,000 people gathered for the yearly rally earlier this month. And according to NBC data, case numbers in the state have increased by 493% over the past 14 days. Now, it's still too soon to know if the rally had a direct effect on the increase or can be classified as a super spreader event. NBC News reporter Gary Grumbach joins us now from Sturgis. He was there 2 weeks ago, back again now. Gary, first, let's start by breaking down the numbers and where are the cases concentrated?
Hey there, Joe. Yeah, South Dakota is really reaching a breaking point here. We're seeing, as you mentioned, almost 500% change in number of cases from 2 weeks ago to today. And we're seeing a 17% positivity rate across the state, which means it's not just in any one area. It's not just anywhere. It's just everywhere across the state of South Dakota. And in Meade County specifically, 1 in 3 people that are testing for coronavirus are coming back positive. That's when we talk about community spread. That's how widespread and deep it is in these communities. 1 in 3 people. What's of course not helping here is the incredibly low vaccination rates across the state. We're seeing about a 55% vaccination rate statewide, but here in Meade County, where Sturgis is, where the rally was 2 weeks ago, it's less than 40%. And as we're seeing in the hospitals, 90% of the people in hospitals are unvaccinated. Joe?
And looking at the numbers there, you can see the positivity rate, 36% in Meade County right now. That is an incredibly high number. So in the wake of all this, the governor and other state officials, are they doing anything to try and handle this rise in cases?
Yeah, South Dakota Governor Kristi Noem has been very clear about the fact that she does not love mask mandates. She does not love vaccine mandates, and that's not going to happen in this state. Now, so doctors and people that are here, the people that live here in Sturgis, they're big on their personal freedoms. They do not want the government telling them what to do. And so doctors are really taking this into their own hands and how to get the vaccine out to people. Here's what one doctor we spoke to yesterday had to say about what he's doing.
Our approach has been, okay, what is making you not want to take the vaccine? And the more we can do that, we've seen a slight uptick in the vaccination right now. And that's the only way we see forward, because the other way we've noticed people tend to write us off or call us judgmental and not do the thing that would save our lives.
Now, for their part, the South Dakota Department of Health does tell NBC News that they are actively trying to track any cases that may have come from this year's motorcycle rally. Joe?
Hey, Gary, how are doctors and nurses there handling this huge rise in cases, and are hospitals prepared, and how are they preparing for next few weeks are probably going to be pretty rough?
Yeah, so the frustrating part of this for medical professionals is that they literally expected this because this is what happened last year. After last year's motorcycle rally, the CDC says more than 400 cases came from the rally and ended up spreading and causing a rise in cases across the entire region. Right now in South Dakota, they're good on space, they're good on stuff in terms of PPE and ventilators, but they're going to be facing soon a real staffing challenge if cases continue in the direction they're going. They say they're ready to bring in the National Guard if needed.
Wow.
Joe?
Of course, the difference between this year and last year is that Delta variant. All right, Gary Grumbach, thanks so much for your reporting.
Let's now bring in Dr. Amesh Adalja. He's a senior scholar at the Johns Hopkins Center for Health Security. Dr. Adalja, always great to have you with us. Now, as Gary just reported, it's still too soon to necessarily tell if the spike in COVID cases is linked specifically to the Sturgis rally, but just give us a refresher on super spreader events, holidays, these types of things where people get together. How long does it take to see a rise in cases and hospitalizations after an event like that?
So after a super spreader event, and those are areas where you have, or a certain event where you have a disproportionate number of spread usually coming from maybe 20% of the people that are infected. It's kind of that 80-20% rule, where 20% of infected individuals are responsible for 80% of cases. And often it will be where there is high-risk environments, indoors, people doing certain activities that really increase the spread of whatever infectious agent you're talking about. And you will see cases go up in the next week or so after a super spreader event. It takes some time for hospitalizations to go up because they lag cases, because people have to get sick and people have to get sick enough to go to the hospital. And it's a little bit disrupted because of the fact that there is some level of vaccination, some level of population immunity. So it's not as correlated or as quickly correlated as it would be in the past. But certainly what happened in Sturgis isn't going to help, especially because the county that it occurred in is one in which vaccination rates are very, very low. We know how to do mass gathering safe. We've seen it with Lollapalooza and other events. It just doesn't seem like many of the precautions were applied, all of the best practices during this rally, just like last year.
Now, Doctor, I want to talk vaccines. We had two pieces of news from Pfizer this week. Of course, that full FDA approval, but then also this booster dose, approving this booster dose for people to get of the Pfizer vaccine. So if many people haven't received any vaccine, they haven't got their first shot of any of the three that are available, what challenges do you anticipate in people actually going to get this booster shot, signing up for a third appointment in the case of these two originally dosed vaccines? Do you think people are going to go do that?
I do think that people who want to get boosters are going to get boosters, and polling shows that they do, even though there's a little bit of a debate in my field about what the need is for healthy people to get booster vaccines at 8 months when the vaccines are holding up against what matters, serious disease and hospitalization. What the problem we have in the United States is not getting third doses or second doses of the J&J into people's arms. It's first and second doses. That's what prevents what's going on in Mississippi. It's first and second doses, not third doses. So I think we have to think what we want to accomplish in this pandemic. And to me, it's decoupling cases from hospitalizations. And the way you do that is by getting first and second doses into people. And the third doses are going to really be preventing mild illness in vaccinated people. So that's something that people are questioning. What's the value of doing that? And how is that going to change the trajectory of the pandemic? So this is something that there needs to be a little bit more robust debate. We'll see if the FDA approves a third dose and what the CDC ACIP committee says about this. But there isn't strong clinical data that our vaccines are eroding against what matters, which is serious disease and hospitalization.
Dr. Adalja, final quick question for you. It's on this news about pregnant women in the South. They're seeing a rise in cases of COVID among pregnant women, and only 23% of pregnant women are fully vaccinated. So what would you tell pregnant patients who haven't been vaccinated about the vaccine, who might be nervous, thinking about their baby, and the risk they face if they contract COVID?
I would tell them to go right now and go get vaccinated, because you are at higher risk for having COVID-19 complications, COVID-19 hospitalizations. And your baby, your pregnancy is at risk for preterm labor and other complications if you were to contract COVID-19. The vaccines are safe and effective in pregnant women. We've got a lot of data. There's been a lot of myths that have been spread and lies that have basically harmed pregnant women because they haven't gotten vaccinated. This is something they need to do. They will pass antibodies through their placenta. This is something they all should be doing and should have been doing for a long time.
Dr. Adalja, as always, thank you so much for joining us.
Thank you.
Time to get a check on your morning news now weather.
That means that Janessa Webb is with us this morning. Hey, Janessa.
Hi, good morning. Man, we are dealing with the heat and humidity. It just will not back off. I know people are starting to think about fall. Well, at least I am. If you're across the desert Southwest into the central tier, even the Northeast, we are dealing with another heat wave that continues to build. Sections of the desert Southwest, we're looking at air temperatures of 117 degrees. But if you're across the East Coast, 69 million people impacted with heat advisories for today. That will extend into your Friday afternoon, and we're going to continue to watch some of these advisories really expand into the mid-Atlantic as well. So let's take a look at some of these temperatures. Air temperatures are going to fall in the lower to mid-90s, but the feel-like temperature this afternoon, we are talking about 110 degrees, and that starts to really extend into the deep south as we head into your Friday. Also watching a threatening storm heading for the weekend coming from the tropics. We will talk about that coming up, guys.
All right, Janessa, we'll see you then. Thanks so much.